Make sure the patient knows what you're doing, so explain the procedure to them. Make certain that you have an order to take it out, because that would not be cool if you took out a catheter and there was not an order for it. Also, have some alcohol wipes, because when we do have a patient with a Foley catheter, it's hanging here, and we may we'll need to measure the urine in the bag before we discontinue it. We'll need to empty the bag, and then we have to document what was in the bag, okay? So get used to looking at how you unclamp a bag. Whenever you empty a bag, put a cloth on the floor, get some gloves, because you're dealing with bodily fluids. Empty the bag. You always empty the bag before you take it out. Clean the spigot with alcohol. You'll drain it into a graduated cylinder. Okay? Clean with alcohol. Why would it be important to be cleaning this with alcohol? Yes, and this is a bladder ladder, right? So we want to keep it as clean as we can. Okay, so now I'm going to look to see how much I drained. I will put that in the toilet, document it. Change my gloves. Hand hygiene.
And you're always working below the bladder. You don't want that bag to be lifted up so that bladder goes back up in, or urine goes back up in. Once the urine gets out into this tubing, you should assume that it's no longer sterile. But urine in the bladder and the internal environment of the bladder is always sterile. So whether you're transporting the patient in a wheelchair, helping them walk, that bag always needs to be below their bladder so you don't run the risk of that urine going back up into the sterile environment.
As a nurse, you will never take a sample of urine from the bag, okay? You'll clamp off your tubing. And I always kind of struggle with the clamp.
I like to
Clamp the tubing.
C-clamp wire.
Clamp it for at least a half hour, okay? And then you can grab a sample. You don't grab a sample from the balloon port. You grab a sample, you don gloves, grab a sample, or don the glove, man, from this port. And this isn't for real, because usually
there's a twist on.
Because it's a lure lock, just like our needles. And then you withdraw the urine, and you would put it in a sterile urine container and send it to the lab. When you send your sample to the lab, if you can't get it there right away, it has to be refrigerated. So, and it can't be refrigerated forever. So you have to be timely when you take samples. Okay, so hand hygiene. I'm gonna take this out.
Thank you. I did hand hygiene. As I walked into the room, in case you didn't see that.
We left and came back, and magically everything was here and ready. This part is not sterile, okay? So the insertion is sterile, this part is not sterile. So either a towel or a absorbent pad I like to have. I've emptied my bag. I'm gonna bring that up now because I'm gonna take it out, okay? I need to deflate my balloon. So that will go into the balloon port, and it will do it automatically. Okay? You doing okay, Allie? All right. Take this off. Okay, you're gonna feel me pull out your catheter. 1, 2, 3. All right, good job. All right, I have to do an assessment now. I have to assess to make certain that the tip is intact of my catheter. Because if the tip isn't intact, where is it? In the bladder. And we better let somebody know right away if that tip isn't intact. Okay? I want to show you the balloon outside of a patient. That is what keeps the bladder in place. Or the catheter in place in the bladder. And it deflates just by hooking up the syringe. Okay? Now, this isn't drippable, pourable, squeezable. That's the rules. If it's drippable, pourable, squeezable, it needs to go in a red bag. Or if your patient's in a isolation room. Otherwise, it can go right into the trash. You don't leave that trash in the patient's room. You take it out when you're done and put a new bag in. Okay? It's not like at home where you stuff more in it. Okay? Now I need to, if you pull it out really fast, you can get urine all over everyone. So when you pull out, sometimes you want to have this width and pull out. And then this can be in the garbage too. Okay? One more step. You have to do peri-care once more. So grab your,
And use those Clorox wipes on and just pretend like they're wipes.
oh, yeah, I'm like, no, I thought that was,
No, we'll pretend these are like body wipes.
we're gonna wash her off because we put lubricating jelly and that kind of jazz on her. Don't use Clorox or Sandy wipes on your patients,
Please.
okay? All right.
What if the patient is on?